This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Welcome back to the program. Well, joining me, as often is the case, is Russ McDade. He's the president and CEO of the Pennsylvania Healthcare Association. We have two big topics I want to get to with him. First of all, let's talk about Medicaid. There's been some concern expressed by Governor Wolf's recommendation to the governor, report to the governor about Medicaid spending. First of all, how does that affect what you all do? Let's start with, narrowing it down to the nursing homes.
Yeah, thanks, Terry. And last week, Governor Wolf announced his proposed budget for the next fiscal year. And the safest way to describe that as it relates to our skilled nursing facilities is devastating. For the fourth straight year, there was no increase in funding provided for our seniors and the caregivers working in our nursing facilities, while their costs continue to grow. And it's simply not a reality that they can accept or we can accept.
Okay, so are you going back to the obviously, this process is starting with hearings and budgets due June 30. What are you specifically asking for?
Well, in this year's budget, we're asking for an increase that meets the inflation that we're seeing in healthcare globally. And really all we're asking for is the same level of support that a number of other areas have gotten. Since Governor Wolf took office, we've seen a 10% increase in basic ed, K-12 education, over those four budgets. We've seen a 10% increase in corrections spending over those four budgets. Probably most telling, we've seen an 18% increase in spending on medical care for our prisoners in our state correctional system. So the legislature and the governor are acknowledging that costs of medical care in correctional institutions are going up, and not acknowledging the same reality in providing increases for nursing facilities.
Let me get this straight, and you'll correct me, you're the expert. First 90 days you can use Medicare. After that, then it's Medicaid funding that essentially gives people health care. I mean, am I right or wrong? Health care and a place to reside, live, because otherwise they would be, tell me if I'm wrong, out in the street in many cases. All right.
That's correct.
How many folks are in your nursing homes that would be eligible?
We've got 52,000 Pennsylvanians that rely on the state Medicaid program.
That's the size of
each and every day to pay for that. That's right.
That's the size
That's
of a
right.
small city.
And our nursing facilities are losing on each one of them a little under $10,000 a year. And you multiply that times the number of individuals in our facilities, that's a meaningful shortfall in a time when, as the administration's noted with their budget, healthcare costs are escalating.
So, I mean, it seems to me there are two effects, and again, you're the expert. Number one, that means that you've got to raise the prices. Your costs go up, so the cost that you have to transfer to, recipients of your care go up. Number two, it means you got to be even more careful about what kind of services you provide. Am I on the wrong path here?
You're on the right path, Terry, and there's a third effect. And since the end of 2014, over 100 Pennsylvania nursing facilities have either been sold or gone into what they call receivership by their lenders or declared bankruptcy. They've changed hands. A few of them have closed for good. Most of them are now in new hands, and that's largely because of this fiscal crisis they face because of Medicaid underfunding.
All right, optimistic or pessimistic that you can get some kind of change. Now, the revenues are up in the state. As you've reached out to lawmakers, what's your sense?
I'm ever the optimist.
Good for you.
And I think we have to be. I mean, our seniors deserve that support, and the direct care workers who come in as a dedicated folks, as you will find. They're underpaid and overworked, and it's because of the realities we face in the Medicaid system, and we need to get them more support in this budget.
Very important topic, skilled nursing care. What's the latest? What do you want our viewers to know?
Well, Terry, I mean, outside of the funding increases that we spoke about, the single biggest challenge facing our skilled nursing facilities is the need for lawsuit abuse reform and to end the frivolous lawsuits that are brought by predatory out-of-state trial lawyers.
Well, give me an example of, I mean, the fact of the matter is there proposals in Harrisburg in the legislature right now that are important to deal with that?
There is a bill on the table, and it's been introduced in response to, we've all seen ads in papers, and there's no correlation whether it's a good facility or a troubled facility that's targeted. In fact, we had a facility in Lehigh County that didn't have a single citation from the Department of Health for a 6-year period that was targeted by one of these ads because the operator of the facility has deep pockets. That bill is House Bill 1037. It's introduced by State Representative Warren Kampf. It's in the Pennsylvania House of Representatives right now awaiting action, and we're hoping to see some action on it as we move forward.
So, I mean, what are the kind of limits that you think, you have to obviously be careful about that you would like to see placed?
Well, House Bill 1037 would do the same thing we did. You'll recall back in the early 2000s, we had challenges with our physicians.
Right.
We couldn't get access to some specialties in Pennsylvania because of our tort climate. The legislature passed the MCARE Act and capped punitive damages, that big jackpot number, so that they wouldn't be put out of business with one awful lawsuit. So
one of your big goals, a cap?
Yes. The House Bill 1037 just establishes the same cap on punitive damages for long-term care facilities as doctors have had to level the playing field. And it's important to note it does not take away anyone's right to sue, nor does it limit the amount of money they can get for pain and suffering. And that's all compensatory.
And there are legitimate concerns, that people have, not just in your area, but in others as well.
Absolutely. And each and every product we purchase in Pennsylvania, a day of long-term care included, has a tort tax on it. As you noted earlier, there's a cost when these facilities are continually targeted, and it does get passed on to the consumers. It gets passed on to the state Medicaid program in the form of $104 million a year in dollars that should be going to care, but instead they're going to predatory out-of-state trial lawyers.
All right. Well, as always, I want to thank you for coming in. You're always welcome, and we'll follow these discussions as time goes on, particularly on the budget side. We'll see where that goes. All right. I want to thank you for watching this week's edition of Pennsylvania Newsmakers, and as always, stay well.